Great. Okay, so we'll go ahead and get started, being conscientious of people's time. We anticipated this would probably be a small group. And for our every other week schedule, that would put us on the 17th, but I was going to check in with Lynn Pinnell. She helps coordinate Bristol coalitions that has focused primarily in Bristol, Virginia, but maybe that's on the second Tuesday, Melissa. We may let that be our, the meetings for this month would be those two, this one and the Bristol Coalition's meeting. We know everybody is overwhelmed and with work and trying to get as much done so that people have time to enjoy the holidays a little bit. And go from there. So I want to welcome everybody, and I think just about everybody on here knows I'm Margaret Firerobin, and we do this. We started in March of 2020 and met every week, and we have gone to thank you. For that Bristol Coalition, we'll try to check and we'll send it out to this group if that's appropriate. If you haven't heard anything and want to attend, Melissa or I or Lynn Pinnell can get you the Zoom link to get in. So don't hesitate to do that. But anyway, so we went to every other week. We were going to every third week or so, and then Delta came in, so we went back to being more frequent. But we may be at a point where we kind of need to revamp a little bit. But want to welcome everybody and thank you for being here. And I'll just start real quickly. Lisa Kofer sent a brief update to say that their grant that allows them to resources to quarantine folks who are homeless in motels when they test positive or when they're waiting for results is supposed to be the end of December, but they're asking for an extension, but may not know anything. The number of folks they've had has reduced over time, which I think overall they had probably fewer than what was originally anticipated from our folks who are homeless being affected directly by COVID, but it has been greatly helpful to have that funding. They still have funding to help people impacted by COVID with utilities and food. And she did not put on here, but they are administering the air purifier monies for the city of Bristol, Tennessee. I know they have had lots of applications, but I think there'll still be resources available so people can apply to see if they qualify. There are qualifications for receiving help with that. So that's the United Way update. I also could say, I think they're still doing their campaign, so any support is appreciated for a United Way that of course supports quite a few agencies and certainly supports all our efforts in our Bristol community. Health, we had Mariah Evans, who was unable to attend. Do you have hers pulled up, Melissa? You could give hers and I'll give Malin's.
I do. She said that for the Mount Rogers Health District, cases decreased last week, and some of that may be due to decreased testing over the holidays. We have a 12.8% positivity rate. A new variant of concern, Omicron, has been identified. Scientists are studying vaccine and treatment efficacy against that variant. Booster shots are available for all adults throughout the community and are available by appointment at local health departments. And Pfizer for 5 to 11-year-olds is now available throughout the community. Appointments are available at some pediatrician offices, pharmacies, and local health departments. And then she just wished everybody a wonderful weekend.
Thank you. Malin Luttrell, Mayor of Bristol, Tennessee, they have Friday morning meetings, if not every week, a couple times at least a month with the health department. And his report from this morning is To date, Sullivan County's had 28,000 cases. The death rate is 1.45%. They're tracking at 48.2 new cases per day, with about 9 of those being school-aged children. The positivity rate for Sullivan County is 17.7. That compares to the Mount Rogers district area right now is 12.8. Fairly similar. And I'll remind, at the beginning of this, we were concerned about a 5% positivity rate. Now we kind of think that, oh, well, 9%, that looks good. So we certainly have changed perspectives. 206 people currently in the hospital, and that's in all of, I think that's all of Ballard's system. 150 to 180 people being monitored at home under the Safer at Home program that they have. And reminding folks that about 92% of the cases are unvaccinated folks. Data showing that we're headed in or already in a third wave of what's to believe to be the Delta strain. For our region, just like we're seeing across the United States. And 5 states have confirmed the Omicron variant. We don't have it in Tennessee identified yet, but anticipate everybody's going to see that. And as y'all have, I'm sure, heard, it's progressive. It's projected to be more aggressive in mutation and likely to spread faster. And there's still a lot of unknowns, and I think it's important to help people understand that it's not magically figured out what's needed or how things work. We saw that with previously with masks not recommended at the beginning, and as we found out more, recognizing how critical masking is. So it just changes as we find out more. So encourage folks to recognize that that's how it works. It's difficult to project it all ahead of time. So those are the health updates and I'm sure we might have more from different folks who are here today. So with that, I think maybe just we'll go across our screen and see who might have updates, and I'll call on you if that's okay, so that you don't have to worry about what order you're in on my screen or somebody else's. So Linda Austin, I'm looking at you for maybe starting us out and giving us an update. And if any of y'all have updates you want to put in the chat, if you want to put your name and email in, we do send out the recording, we send out the chat. Also a reminder that you get this email with everybody's email address on it. We do that most of the time on purpose so that if you needed to find somebody's email address, you can sort through and try to find it. You can also always email me, Melissa, to get contacts. And sorry, Linda, I called on you too soon. Last time we also sent the list that we had. So if you have opportunity to check, I've only gotten one correction on that list that I sent out. So if there's any corrections on that, or if you see that somebody's not on it who should be on it, absolutely send that to us so they get invitations. Okay, Linda.
Yes. Hey, good morning again. ASAC, we did have a Narcan training Tuesday night at the Bristol Library, and we trained and dispensed Narcan to 21 people. So we're very happy about that. Many of them were library employees and Mount Rogers GED program employees. So, we're happy about that.
So
our
Linda,
ASAC meeting is coming up on.
Would y'all consider, I mean, that was pretty good turnout, even if it was just library staff folks. Would you consider doing that again at the library? Is that a spot you're reaching out to?
And I've been trying to schedule it with Lynn Pinnell at the Envision Center. She wants to do it when her staff is available, and we're having some problems. But any of you, I can't come across the Tennessee line, but we could schedule it on the Virginia side, and we don't ask where anybody's from. all we need is a signature and either an email or a phone number in case the lot number of Narcan that they've received is recalled. So we don't care what state they're in. We just want it out in the community before the holidays.
So when you, if you get that one scheduled or other ones in the Bristol area community, if you can, we put stuff on our calendar, but I think it's helpful also to send out a separate email to encourage folks. I could see the Envision Center being handy for a lot of staff people to be able to drop by there and get trained. That sounds great. Okay, sorry, keep going about your meeting.
So December the 9th is our next ASAC meeting. It is going to be in person at the Wise Inn, at the inn at Wise. I'm not sure what the proper name of that place is, but it's a scenic drive. If anybody wants a road trip, we're going to spread out. From 10 to 12, we're going to hear from the Health Wagon and also the Comprehensive Harm Reduction Program in Wise County. And then we're going to have lunch following that meeting. So registration is required. If any of you are interested, it is an event on Facebook on ASAC's page. Let's see, we do have a virtual support community called Hope for Hurting Parents. It is virtual at 7 o'clock every Thursday night. That link is on Facebook as well. It is for parents and grandparents who have a loved one making destructive decisions, whether they're struggling with mental health issues, substance misuse, they're getting in trouble at school, hanging out with the wrong people, whatever the situation is. If they need support, there is a community. Right now it's females, but we certainly welcome men to join the group as well. So that's at 7 o'clock every Thursday night. And they did even meet on Thanksgiving night because the holidays are very difficult for folks that are struggling. So please help us get the word out. We want that group to grow because we know it's a huge need with families who are struggling. So if any of y'all, I put my information in the chat line. Anybody who would like to be part of ASAC's email list, you can get information. We are going to try to schedule some educational town hall meetings. I'm sure you guys have seen the Delta 8 billboard as you start down State Street. Delta 8 is a THC additive, and right now there are 4 children's cereals, Fruit Loops, Cinnamon Toast Crunch. The bags are much smaller and they're much more costly. They're being sold at convenience stores and vape shops right now. There's a 3-year-old in Roanoke that overdosed on one of the cereals. A serving has 500 milligrams of THC in it. And so that's something that we need to alert our community, especially our parents and grandparents who are raising kids about. So a lot of adults are buying them and they're not protecting them, and children are getting into them. That's just one more edible that we have to be concerned about. So we will be scheduling some information about that and getting that out in the community as well. So thank you all.
Thank you, Linda, and thanks so much for what you do, and your reach is far and deep. So appreciate you, and we all can learn from you a lot. So Chelsea, you're next on my screen. You want to introduce yourself and talk a little bit with any updates?
Yeah, hi. I am the homeless outreach coordinator for the James H. Quillen VA Medical Center. I don't necessarily have any updates to share with you all. Just wanted to put out the reminder that we have expanded our eligibility for our homeless programs for veterans experiencing homelessness. So they don't have to necessarily be eligible for VA health care in order to be eligible for our homeless services. And as the outreach person, I'm now being able to get out into the community. So if you all are aware of any homeless veterans or areas that I can go, especially up into, more of the rural areas of Southwest Virginia, I'll put my contact information in the chat as well.
Thank you very much. And good to hear that expanded services are available. That's great. Kay Ward, you're next on my screen.
Good morning. Well, from the school system, I have some Tennessee high school traditional events for this time of year to remind you of. And the first is that our Christmas madrigal dinners are back for 2021. These will begin on Thursday, December 9th, and will run through Saturday, December 11th. These will be at Avoca Christian Church in their gymnasium, and you can order tickets online at the Tennessee High School website. We also have the 2021 Winter Band Concert coming up. This will be on December 7th and will begin at 6:30 with the Tennessee Middle School 6th grade band. 6:45 will be the Tennessee Middle School 7th grade band. At 7 o'clock will be the Tennessee Middle School 8th grade band, and the Mighty Viking Band will appear at 7:15 with a percussion ensemble. We also have our traditional basketball tournaments coming up. We have the Arby's Classic, which is always hosted by the Tennessee High School boys basketball program. This year it will be December 27th through 31st. Passes went on sale on Wednesday, December 1st. We also have the women's tournament, Holiday Hoops, hosted by the Tennessee High School girls basketball program. And these dates are December 16th through December 18th. So we are getting back somewhat to normal with our traditional events over the holiday season, and we hope you'll enjoy it. We hope that you will enjoy them and can join us. Thank you.
Thank you, Kay. And I can welcome on is Amy Zeps. She can pronounce her name in a minute when we call on her. But we have two new part-time AmeriCorps workers at Family Promise of Bristol, and we are working. One of them, Kay, is working on putting together a document that'll be a Google Doc with all the different help for Christmas toys and family support, etc. That we'll have as an ongoing document that we can put deadlines on, etc., so that there can be a resource that we all understand what's out there with Santa Pal, with the Joanna Berry, with Sullivan County Rescue Squad, some of the different ones that are out there. So you want to weigh in?
Well, that's awesome. We will begin distributing Santa Pal sponsorships within the next week or so from the Family Resource Center. Today is the final day of the Joanna Berry Toy Drive. In our school district, we use those toys to serve children who have, for whatever reason, fallen through the cracks. In other words, they're not being served by another charitable holiday organization. They haven't qualified for Santa Pal. They're not on the Angel Tree. We'll receive those toys on Monday evening, bring those back to Bristol, and our school counselors will meet together on Tuesday morning. They'll come to the round building with lists of children that parents have contacted them that they will need help for Christmas and they aren't on another list. And we will redistribute those toys back into all of our elementary schools and Tennessee Middle School. So we're really excited about the Joanna Berry Toy Drive. It's a lot more traditional this year. We, of course, were in the big time COVID this time last year, so we had to distribute outside and the Burt Powers and Hardy building, and things are somewhat back to normal. This year we'll be back at the administration building, and we certainly are looking forward to that. So today is your last day. If you would like to contribute to the Joanna Berry Toy Drive, you need to know that all toys that are collected in Bristol stay in Bristol. So they stay here and go to our boys and girls on both sides of the state line. So we hope folks will participate. We're looking forward to it.
Great. So yeah, I think our community does a great job to try to really make sure that our children are taken care of, as well as trying to get our families taken care of too. So, and if we can make that a little clearer with some putting some stuff in writing to help us all figure that out and understand. And also that with falling through the cracks, we know we have close to half of our community either falls within the federal poverty guidelines or the ALICE, the United Way's ALICE income level, which means people do struggle to meet the needs, meet the Christmas needs and wishes of their families. So having that flexibility, Kay, is great with that program as well. So you want to add?
Well, I think it's a great thing to have those dates and to have those guidelines posted in a central location that people can find. I will say that with all these programs, we do our absolute best at being good stewards of community generosity.
Right.
We want to make those resources stretch as far as they'll go and serve as many people as we can. So there's a lot of collaboration among these holiday organizations as well as with United Way. And we're very hopeful that we can serve as many folks as we can. In other words, that folks aren't served twice. And if they aren't served twice, then we're stretching those dollars. And that's exactly what our intention is. Serve as many folks as possible.
Fantastic, fantastic. So yeah, and it's also figuring out the routine for last minute folks that we're working with that we just didn't know about, or those are some of those falling through the cracks, and trying to help them out when some of the deadlines have to be a whole lot earlier in the fall. So trying to—
Well, as a rule, the Santa Pal deadline is the 1st of October.
Right.
We distribute, and we have Santa Pal applications available at the Family Resource Center and also in our counseling offices just right after Labor Day. And so that's information that most likely needs to be posted because the Santa Pal deadline is early. It's the 1st of October.
Great. We'll get that into that document too. So thank you, Kay, very much. So, okay, Ellen Tolton, Bristol, Virginia, and Christina, we'll call on you next.
Good morning. Just a couple little things. First of all, you had mentioned United Way. They had a grant that was running out of funds for them to quarantine homeless individuals. They are still eligible. The CDBG programs, both me and Christina, had provided them with some funds, some of our CV funds. So they do have a few of that funding left to use for quarantining individuals. The other thing,
Ellen, just clarification, it can go past that December 31st deadline, is what you're saying. Great.
Yeah, the CDBG CV funds have a few years left on them. So it's a pretty extensive timeline. So they're good. The other thing I would mention is every year I receive CDBG applications for CDBG funding. Nonprofits and other eligible organizations can apply for CDBG funds from the city for economic development, for public services, for housing, public facilities improvements, that kind of thing. And they will be coming out in the beginning of the year. So I just wanted to give everybody a heads up. Some of you have applied and received funding in the past. And the other thing is I usually send them out to the folks that I know. I'm going to put my information in the chat box if there's anybody that is interested in getting an application, or if you have any questions, or if you want to run by a project by me, just give me a call or send me an email. And the last thing I wanted to mention is we are once again sort of closed doors at City Hall, but if anybody wants to come by or see anybody, you need to have an appointment with that person that you want to see. So I just wanted to give everybody a heads up about that. That's about it.
Thank you, Ellen, very much. I was going to add something, but I can't think. Anyway, I'll think of it. Christina, you want to add to Ellen's? Y'all do such a great job coordinating together with your CDBG and other community work.
Well, since you said that, I will tell you that the homeless quarantine funding that United Way was talking about was ours with Bristol, Tennessee. Our contract is to end with them at the end of the year. And I know, Ellen, I don't know if yours had a time frame on it, but ours did expire December 31st. So we are looking to extend that for them because they do have a couple of $1,000s left from the allocation that was approved first, but I can't
Can't do that.
yes yet. So yeah, and I'm honestly, I mean, she's not on here, but I'm sure it's going to get extended. So anyways, our COVID Cares partnership, like Ellen talked about with United Way 2, is still going strong. And then our regular CDBG and home consortium programs are busy and on wait lists. And it seems like that's the new thing these days. Not that housing wasn't already getting hurt before COVID. I mean, we are all certainly on wait periods at this time. So.
Right. Great. Yep. And I know a lot of people on here know how government grants work and federal grants, and there's always hoops to jump through and different things. So we'd like to snap our fingers and make things happen, but that's hard to make happen even when we're in charge closer to home, but it's difficult. So anyway, okay. Thank you. All right, I am looking to Dottie Havlick.
Hi, I'm Dottie Havlick, President of the Board of Family Promise of Bristol, and we are continuing with our grant to prevent homelessness. We do not have funds to help people who are already homeless, but people who are in danger of losing their homes because of back rent or utilities or things like that. We also have a short waiting list. We're trying to work through it. Most of that is that it's hard to find places for people to rent. So we have a housing shortage in Bristol that everybody who tries to place people is well aware of. And we are still working toward our day center, and we will be coming to people very soon, we hope, with a nice announcement of plans to cooperate with the Salvation Army. We're working out details, and so we're thrilled to be working on that still with many of the same people and a few other people who have joined our I don't know what you call ordeal of trying to work through having a day center in Bristol, but we are hoping that is going to happen after the first of the year.
Thank you. So Amy, do you want to introduce yourself briefly? See if
Yes.
you go.
Do you want my video on?
That would be nice if you feel comfortable. Some people have it on and some people don't. It's up to you.
Hi, everybody. My name is Amy Zapes. I'm originally from Ohio and moved to this area about 9 years ago with my 2 children who are now grown. I'm looking forward to working with Bristol Family Promise. I just know there's definitely a need. We've been out doing some canvassing in the area with arts and looking and noticing that there are homeless people that are outside, and it's very hard to lay in bed at night in your own warm bed when you realize that there are people that are in freezing weather with no shelter and nowhere to go during the day to warm up. So thank you for welcoming me. I'm really excited to see what we're going to get into and hopefully be able to serve some people.
Thank you, Amy. So, and we're excited to expand AmeriCorps workers in our community. The Arch has the ability to work with AmeriCorps. And also Second Harvest Food Bank has AmeriCorps workers as well. But when they apply for specific areas. So it's not geographic only. They apply for topics. So the Second Harvest work with food, and the Arch works with homelessness. So there's different specifics. So we're glad to have folks that build capacity building in our region and in our community. So thank you, Amy. Okay, and next, if Sandy Hendricks with Ballard Community Health Workers.
Hi, first I want to thank everybody for all the amazing things that y'all are doing in the community. We just try to help connect patients to social resources so they can focus on their health. So we call on you guys a lot, and y'all are incredible. We've just added 3 new team members as community health workers, and we are still hiring. So we're expanding right now. We have community health workers from Greenville to Damascus, and we're wanting to expand beyond that. So we're growing, but the need's growing as well. And thank you.
Thank you, Sandy, very much. And thank y'all for the great program and for y'all's participation on here and what you do to help. And something that I've been realizing with working with Family Promise is that I think we have lots of great services. We collaborate, we work together, but I think the area besides housing and transportation, things like that, I think we lack the intensive case management that's required to really help transition folks out of poverty. We have a few programs, the Pathway of Hope at Salvation Army. Victoria was on here. The Lynn Pinnell's Find a Way program at Bristol, Virginia Housing is another one, but that intense where wraparound services and folks walk the walk with people for the time that it takes them to succeed. And we know that's not weeks, it's usually not months. And so how do we try to do within a system that isn't conducive to doing that? How do we do that? So that's just, I think, a challenge to all of us, and maybe warrants some identification of where that is occurring and some discussion on, are there ways we can make some of that happen within the constraints, those constraints being capacity and funding, to have folks who are trained case management folks to really walk the journey with folks. Anyway, so that's my observation. We can perhaps get somebody in to talk about it and have further discussion. Brittany Bowles, glad to have you here. Talk to us a little bit.
Okay, can you hear me okay?
Yes.
All right, great. So I'm Brittany Bowles. I'm the Community Engagement Specialist for the Strong ACC. I have been on this meeting a couple times, but it's always just great to hear about all the amazing work that you all are doing in the community there. So just a couple things I wanted to share with you about what's going on with the Strong ACC. We have the Bright Start Northeast Tennessee Initiative going on right now, and if you haven't heard much about that, it's an early childhood education initiative from Tennesseans for Quality Early Education. So it's really focusing on those children birth through 3rd grade and making sure that our Tennessee children are both reading at grade level and proficient in math at that 3rd grade benchmark. So what we're in the process of doing right now is our community engagement. So we want to hear from the community, from parents, from K through 3 teachers and administrators, from childcare providers. We really want them to come to the table and share, what's going well in your community and what needs improvement. So we have a couple ways to do that. The first is the soonest opportunity to do that is Sullivan County Town Hall meeting, which is coming up on Tuesday, December the 7th. And we're actually going to hold that at Bristol Motor Speedway. Of course, we're wearing masks and social distancing and all of that, but we invite the community to come out to that and share what their feelings are on early childhood education and how we can make it better in our region. And those are going to be held in every county in Northeast Tennessee, all 10 counties. So that's the Sullivan County Town Hall, and I can put that in the chat box as well. And that's from 4:30 to 6 on December 7th. Then also we have 3 work groups that you can sign up for, and those are going to be mostly virtual. We may have some in-person meetings, next year sometime, but right now the 3 work groups are learning environments, health and development, and family and community supports. And these work groups are made up of parents and teachers and people from all sectors that have a stake in early childhood education. And they're really going to help us develop those strategies for that Bright Start strategic plan, which we're planning on having done and completed by June 2022. And then we would implement that plan, implement that plan in fiscal year 2023. So beginning in July there. So we're really excited about all the Bright Start initiative work that's going on in our region. And so if you'd like more information about that, or just have some questions, want to sign up for a work group, I'm going to put my information in the chat box. Feel free to reach out to me, and we'll get you signed up. So thank you, Margaret, for allowing me to talk about that.
So Amy, just real quickly, can you, so we're doing this in Tennessee because the state organization, Virginia, has had efforts for quite some time. They had Smart Beginnings. Can you just talk a minute for what Virginia's efforts are that are parallel, that are ahead of Tennessee? So that's why the focus on Tennessee at this point is to establish some of the same things that have been going on that I think are being renewed, some of those efforts in Virginia, but that's in process.
So the project, the parallel project in Southwest Virginia right now is called Ready Regions. And the United Way of Southwest Virginia, Susan Patrick, Travis, they are all working diligently on that project. And that is for, like you said, they already had a really great start, honestly, on early childhood ed and have done great work thus far. So really what they're doing now is being able to expand their efforts through the Ready Regions grant process. So I know they just submitted to receive that grant funding. I'm not sure that they've received it yet, but I think it's pretty positive that they will, considering all the great work that they're already doing. So yeah, like Margaret said, Ready Regions is the parallel to Bright Start Northeast Tennessee.
Great. Thank you. Yeah, and there are a lot of us who are already involved in the Bright Start, and certainly in the ACC. Lisa Kofer chairs one of the subcommittees. I'm co-chairing one of the, or she might be one of the committees. I'm a subcommittee. I don't know. There are so many different pieces to all this, but I would encourage everybody, if you're not a member of the ACC, that's the Accountable Care Community, absolutely join. And Brittany can be contacted, I'm sure, for that. The other thing that is being promoted, certainly by the ACC and by a lot of us, is the Unite Us. And we've had a couple of programs. Our last session, we had somebody, but just encouraging folks to find out more about it. Is it a good fit? And encourage people to, because that helps our work together to coordinate, etc. Before I call on Tom Quickle and then Melissa to do Bristol's Promise, but Melissa's got a poll too, and we'll probably send that out to the whole group as well about our meeting schedules, etc. So she's going to send that to us, post that. What are you going to do, Melissa, for us to be able to answer?
So you should have seen a poll pop up on your screen. If you'll take just a minute, what we're doing is, you did not see one pop up?
Is it in the chat or is it somewhere else? Maybe I'm host, so I don't get it. Did
I
other
see it.
people see it?
I
Okay.
see it.
Yeah, so what we're asking is, what do you all feel would be most useful to you as far as our next meeting date? Our next meeting date would fall on December 17th. So do we want a meeting date on December 10th? Do we want to have one on December 17th? Now remember that Bristol Coalition is meeting on December 14th at noon. Or do we want to wait until January 7th would be the next meeting date? So if you'll just take a minute and put in there what your preference is.
And we want to work toward a overall effort of doing a community-wide regular, well, this is it. We want to work with Bristol Coalition so that we don't duplicate efforts. And mostly y'all know what capacity is like with time, just have not had the time to really sit down and envision what that looks like and how it works, et cetera. So that's still on the agenda to try to do a better job of that collaboration. So, okay. Also, I want to point out Nicole Cullup was here earlier, and she's talking about hiring part-time staff at both their Bristol sites and also that they have application at Girls Incorporated. Nicole's a great participant with our group as well. So Tom Quickle, you're our faith community today. If you want to unmute and just say anything, or you're being welcomed. And I think there you
How's
go.
that?
That's
How's
perfect.
that?
That's perfect.
Okay. Yes, my name is Tom Quickle, and I'm retired. I lived here in Bristol for 21 years, and then I took a call to the state of West Virginia, and now I'm returning back to Bristol, and I am retired, and I'm looking for an opportunity to serve in retirement or to serve as a volunteer, no pay involved, just to volunteer. Anyone who could use my services, and I'm listening to all that you're doing, and as someone said earlier, it's fantastic, it's spectacular, all the things that you're doing to help people, the homeless and the hungry and such as that. So if there's any way I can be of help, I would relish that opportunity.
Thank you. And Tom's retired Lutheran pastor was at Faith Lutheran Church here in the Weaver community, Weaver Pike area. And he was active. He helped Bristol's Promise with doing Search Institute surveys a long time ago and was active with it. He helped, I think, at the beginning of Bristol Faith in Action,
Yes.
the beginning of Family Promise at Bristol. So he's been very community active in the past as well. So we welcome him back to the community.
And also Healing Hands and the Larkham Group. I don't know if people are familiar with that, but
Right.
In those days, the faith community really did a lot of this. The work that you're talking about was started by the faith community.
Right. Thank you very much, Tom. So
thank you for the opportunity.
Yeah, and Tom, I don't know if you're able to put your contact information in the chat. If you can figure that out and do that, that would be great. Then people would have it for you. So if you can figure out, find your chat and type in your email address, that'd be great.
Okay.
So, all right, Melissa, what do you have from Bristol's Promise?
So we continue to work with our business partners, providing wraparound services. We did quarterly, and what we're seeing the most need with our workforce partners is housing, which is not surprising to, I think, anybody on this call, and also basic needs. Those are things like electricity, water, those types of things. Food is not listed under basic needs because that's a separate one. We felt like that, pulling that out. We have hired a new family initiative support specialist who will be helping with our parenting program and our Bristol Connect program. This is her third day. So, we just continue to plug right along, and we have about 90% participation on this poll. So I'm going to go ahead and close it down. I will tell you from this group, and we'll send this out to the full group for response, but from this group, 11% would like to see a meeting on December 10th, which is next Friday, but 89% feel comfortable not meeting again until January 7th. So I'm going to go ahead and close this poll. Again, when we send the recording of this out, we'll send it to the full group for response as well, but I feel like that's probably going to be the response.
Great. Thank you, Melissa. And the name of our new staff person?
Oh, sorry. So our new staff person is Danielle Boer, and hopefully she is in the process of onboarding and going through all of the processes that come with a new job. So hopefully at one of our meetings in January, you will get to meet her in person or at least via Zoom.
And also, if you can talk about the next trauma-informed care network meeting, that's right now in February, is that correct?
Yes. So our next trauma responsive care networking meeting is going to be in February, typically in December. The Youth Networking Alliance and Trauma Informed Care Network have a joint meeting. We had that yesterday and just did a virtual holiday gathering, which was lovely to see some of your faces around the screen. But the next Trauma Responsive Care Network actual meeting will be held on Thursday, February 24th, and that's from 10 a.m. until noon.
And the Youth Networking Alliance meeting will be the fourth Thursday in January, and that's usually 12 to 1:30. We anticipate still doing Zoom at this point, continuing. Also, do you want to real quickly talk about the Promise Network and how people can join it, if that's appropriate to let people know about it here?
So the Promise Network is a community platform that allows us to stay connected. We currently have a couple of groups that we've built out. It's a pilot program, but we have a group for the Youth Networking Alliance. We have a group for the Trauma Informed Care Network, both Northeast Tennessee and Southwest Virginia. We've worked closely with United Way of Southwest Virginia and with Ballad Health to make sure that we're capturing both sides of the state line for our Trauma Informed Care Network. We also have our parenting educator group. So if you know somebody who is doing parenting education or involved with an organization that does parenting education, you can join that group and stay connected with other educators in the region. And then we also have the Diversity, Equity, and Inclusion Alliance, or Diversity, Equity, and Inclusion Group, which is working regionally to create a stronger sense of belonging in our community. A lot of the regional alliance folks are on there, and it really is just a way to build community in between, which is sometimes tough. We go from Zoom meeting to Zoom meeting, but if you needed to reach out to somebody in that community, that's the platform that you would be able to reach out to them.
Thank you. And the parenting group does meet on the third Thursday I believe, at 12, and Samantha Gray heads that up. So people are welcome to join that. There's a lot of information on Bristol's Promise website, so you're welcome to go do that. Tom Quickle, we will put your contact information when we send out the chat and the recording. So you're good. We'll add it to that when we send that out. So, okay, anybody else think of anything else that they wanted to add into today's discussion and sharing? Yeah, Linda.
If I can mention, and I will add hands and feet to your list of agencies that provide Christmas to children. We are full. We have adopted 15 children with incarcerated or justice involved parents. So we have 15 kids that we're taking care of for Christmas, hands and feet.
Right.
And also I wanted to mention to you, if any of you are interested, we do have a new Virginia, the Commonwealth has called its Narcan program Revive, which is confusing to some people because Revive, Narcan, naloxone, people are confused about all of that being the same thing. But if you are interested on the Virginia side to train people, become a trainer, that is available online. We do have a new coordinator who's doing a great job. She herself is in recovery, so she's very passionate about her position. So hopefully she's going to stay. We've had some turnover, which has caused some delay in getting trainers trained. So if you're interested in becoming trained to train people how to use naloxone, you can contact me or go on Virginia Department of Behavioral Health's website and get information. It is virtual. It's only a couple of hours. And now the Narcan training is 5 minutes. But thanks to COVID, we figured out that you don't need 2 hours to tell somebody to put a nasal spray up somebody's nose. So if any of you are interested, we would love to have more trainers in the community. So.
Thank you, Linda. And if you would send an email with the information about y'all's program, and what we'll do, we'll see whether we get it done before Christmas or not, but we'll send a link to a Google Doc out for people to check to see what information is there and then see what needs to be added for a Christmas list. But we'll be working on so that by the end of the summer, we'll have a complete list that we can try to get out to everybody for keeping track for the next go around for making it work. Also for the Narcan, Sutherland County Anti-Drug Coalition occasionally attends our meeting, and Linda certainly networks with them, and they work closely together across the state line. But they provide Narcan. They, I'm sure, do trainings as well for the Tennessee part of that. So really appreciate what y'all do and how thorough it's been happening in our communities. So
we did have a young man that we trained at Bristol Rhythm and Roots and gave him Narcan. He took it back to Maryland. He called us and he saved someone's life with that Narcan in Maryland. So we were, people were like, I'm not from around here. We said, we don't care. We don't want anybody to die wherever you're from. And so he did let us know that he used that Narcan and saved someone's life. So pretty exciting to hear that feedback. So.
Yeah, I guess it's probably not the best comparison on some levels, but it's a little bit like Heimlich maneuver, that simple to teach, not complicated for people to learn how to do, and is a matter of life and death. So pretty interesting and pretty good. So, okay, well, we will end up, and thank you all for being here, and thanks for participating. Again, we'll send out the notes and the chat and the recording, and wish everybody, it's probably our next time will be January. So we hope that we all have good holidays. We hope that the people that we serve can make it through the holidays, and that the help that we can provide supports them in doing that. So thank y'all very much and appreciate every single one of you. So take care. Bye-bye.